9/1/2020. I'm Dr. R. Deuk Majan at the Surgery Center Viera, Deuk Spine Institute. Getting ready to start our third spine surgery of the day. This lady that we're about to do surgery on has a herniated disc at T910. It's causing pain in her thoracic spine that radiates around to the right side of her flank. And as I've said before, thoracic disc herniations are rare. Symptomatic thoracic disc herniations are much even rarer than a thoracic disc herniation. So most people with thoracic disc herniations don't have any symptoms. Sometimes they do. So the thoracic spine presents different challenges than the cervical and lumbar. It's Dr. Deuk. We're going to get started, okay? Just lay still. Everything's going to be fine. I'm going to give you some numbing medicine in a minute or two, all right? I'm going to talk to my team, and I'm going to be talking to people on the internet. They don't know who you are, but they can just see your back here, and that's it, all right? So I'm going to get started first by making sure we get to the right place. Shot. All right, so we can see the 12th rib, 11th rib, and pretty much right here would be the pedicle of T10 shot. So that's the pedicle of T10. And then we got the pedicle of T9 above that. Now, I need you to adjust the fluoro. So you're looking down the 910 disc, which will be right about there. So it's going to be either this way or that way. Probably, yeah, that's a good direction to start with. Let's keep going. And shot. Now what we want to see is we want to see that rib at the pedicle. So keep going. And obviously we want the spinous process in the middle. How's she doing? Try going more. Try the other way. Keep going. Go way up. And let's just see what happens. That's good. Shot. I think that's the opposite effect. So come back again. And shot. All right. Definitely an improvement. So just keep it there for now. Yeah, you want to get the spinous processes lined up properly. So work on that. Hey, what's going on here? Because she should be completely awake and cooperative. Is that not the case? And why not? Dr. Arcos. That's better. Understood. So what I would recommend is they shouldn't get any sedation until I get in here and I'm about to start sticking them with needles. Then they should get the sedation. And just while I'm numbing things up. And then again when I go through the annulus. All right, so you can see the ribs of T12 down there coming to the pedicle of 12. The next one up is 11. The next one up is 10. And I'm basically at the 9-10 disc space right now. And we're doing T910, we're doing the right side, I'm on the right side. So give me a marker. Marker. You don't have a marker? All right, never mind. For God's sakes, you guys should have a marker. All right, you're going to feel a little stick and burn, okay? Just lay still. Can you hear me okay? All right. Can you feel that? That's just numbing medicine going in. I'll let you know if we're having any problems, okay? But right now, everything is going perfect. I injected 1 cc of lidocaine, marcaine, epinephrine. So we're going to get started, okay? So I'm palpating the midline. And let me have the coker. And you're pulsing? Shot. I can't see, Luis. Your head's right in the way. You need to come more here. Luis, you need to come more here. That's it, right there. Bring the fluoro screen closer. Your fluoro screen should be as close as you can be without interfering with the surgery. That's it, every single time. Okay? 12, 11, 10, 9. Could be a little further south. Shot. All right, so that's looking pretty good right about there. Pretty much where I injected. Now let's look at it on a lateral view. So go ahead and get me a lateral shot. Give me a lateral view, please. We're fine there. That's just, we're not cutting or doing anything right now, okay? We've just done the shot and we're just taking some pictures to make sure we're in the right place. All right, I need to see my instrument. So fluoro needs, there it is. All right, so that's looking pretty good. Maybe a little bit south right there. Shot? Good. All right, I like that. I like that. Let me know if you feel any discomfort, okay? Can you hear me? Are you awake? Anything uncomfortable? Let me have some num-num. Now we use a combination of Marcaine and lidocaine. This is without epinephrine. Just to numb things up. She's obviously breathing, so things move. We like it that way when they're breathing. Okay, shot. Good. Go back to an AP. Okay, and we got the lateral there, AP there, 12, 11, 10, 9, coming in low on the disc. You okay? What'd she say? Oh, your nose is itching? All right. Shot. Shot. Let's go with a lateral view, please. We're going to use our X-ray 12, 11, 10, 9 to navigate to the disc space. I'm confident we're hitting the right disc space on the AP view. I'm not confident on the lateral, and now I'm feeling more confident on the lateral. There's a double shadow of the ribs. Can you see that? What can we do to improve that? I think you're going to have to raise one side. Yeah, I think maybe you did the right thing. Let's take a look. That's definitely better. I think they're double. I think you just twisted a little bit. All right, I think we're going to have to be a little bit more lateral. No, the other way. Are you comfortable? Shot. Shot. That's the facet. Shot. Okay. A little bit higher than I want to be. Shot. Give me an AP. And we need to probably wag that lateral better so we get a truer lateral. We're not off far, but I'm almost seeing a double shadow on the pedicle. I want to make sure we don't have a double shadow on the pedicle. That looks good. Go back to a lateral view. Keep the AP there and let's go to a lateral view. Yeah. Alright. It's not too bad. That actually looks pretty good. Shot. Shot. She okay? Shot. Shot. So I think we're close, but shot. Okay, I need you to either raise one side or the other. Probably raise my side a little bit because I think we're seeing a not straight across the back of the vertebral body. The other way. Or either you went too far or you got to go the other way. One or the other. No, go. Keep going then. That's almost perfect. I would say just another degree. I think we overshot it, so let's go back. Maybe it's her movement, her breathing that's doing it, but... Alright, that's pretty darn good. I don't think we're going to get better than that. No. May need to start a little bit higher than I am. Is she comfortable? Shot. 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 Let's get an AP view. Shot, first shot, then AP. Give me an AP. You okay? Shot. That's not too bad. Okay, back to a lateral. Alright, it's actually pretty good. This is pretty far south. It's really hard for me to see that and see this.
And also, Crystal, can you do me a favor? Can you turn off slide one? Did you want to stop? Slide one, and sir, can you aim
Is that where we are right now?
Yes, sir. Can you aim that over here, please? Thank you very much. Appreciate it.
Shot.
Thank you.
there. Shot? Hold on. Keep her awake. You okay? Shot? All right, give me a give me an AP, please. On the lateral, we're looking good. I just want to make sure on the AP we're good. Okay. All right, it's not bad. It's not bad at all. We're not quite at the midline, which is fine. We should be in the disc. Any shortness of breath or anything? Huh? Yeah, we're right where your herniation is. That's why it's wrapping around. Tell me if it's a little better. Is it better now? Did you just have pain wrapping around your rib, or don't you have it in the back too? Yeah, so you have both, wrapping around the rib on the right side plus, which is called a radiculopathy, and then you have the axial pain. Is everything better? What'd she say? All right. Must be right up against the end plate. No. Well, I guess I could use this. Give me a lateral shot, please. I'm just kind of buried there. Right up. Shot. Problem is I'm sitting. Could probably pull it back a little bit. Shot. I don't think I got any out. Damn. Shot. There we go. Let me have the guide wire again.
Yes, sir.
Are you comfortable? Shot. Just can't seem to get it to come out. It's very strange. There we go. Shot. Give me an AP. So you kind of felt that same pain around your ribs when I was going in? Yeah. Yeah, you can see the dye along the spinal cord. We're well away from the spinal cord, which is good. But we're right in the frame and right where the herniation is, so Didn't really get the discogram I was hoping for, but let's see if we can't try a little bit more manipulation of that. No, I need the stylet. We're going to put you to sleep in a few minutes, okay? I'm happy with where we are, but I want to see if I can make it even better, okay? So just bear with me for a moment. Shot. Should be better.
One more.
I'll try. You okay? Shot. Let's go lateral. All right. Well, we're in the herniation. And if you look at the x-ray, you can see L1 down at the bottom, 12, 11, 10, 9. We're at the 9-10 disc. And we're really in very good position. So we can go ahead and put her to sleep. When you wake up, we'll be done, okay? So far, everything's going well. You're welcome. All right. Can you count out loud from 1 to 100, starting at 1? Keep going. You're doing good. Shot. Keep going. Keep going. You're doing good. Nice and loud. It's a stab incision. 4 millimeters. Same as cervical. It's a Band-Aid incision, 4 millimeter incision. You all see that tiny incision there, Sean?
Yes, we can.
Keep going, you're doing great. Shot. Sticky. Keep going. You're fine. Thank you. That's perfect. So folks, what we're doing is a transforaminal thoracic disc repair. And we're just, you can see where the tip of the dilator now on the lateral view is just lateral to the canal in the soft tissues on the side of the spine. Our goal is to be just medial to the lung field and pleural membrane and just lateral to the spinal cord. Shot. We're aiming for that disc right there. That is the T910 disc. I know it's hard to see. I can't do any better for you, but that's the best we can do. And I'm using my guide wire. And of course, shot. Really the hard part of the surgery is just to get the needle from the outside world to the perfect spot on the back of the disc, which is what we've done with the needle. And once you do that safely, then the inside of the needle should be safe. If the outside of the needle is safe, the inside's safe. So of course the guide wire goes along the inside. All right, give me an AP, please. The guide wire goes on the inside of the needle, and it's sort of a placeholder, a placeholder of safe passage, so to speak. And now we're bringing a larger instrument down because we want to use a tubular dilator. Yeah, actually it's 100% perfect, absolutely perfect so far with respect to where we are. You want to be right where the pedicles line up, which is where the tip of the dilator is when you get to the back of the disc. And that's exactly where we are. So we know I can actually feel the herniation right here. And it's hitting the T9 nerve root. Go back to a lateral. It's hitting the T9, the herniation coming out of the back of the T910 disc on this right side that we are on is actually in the foramen, in the front of the foramen, the anterior foramen, pushed up against the nerve root. That's, it's probably actually the T10 nerve root that is pushing on, because it's not really a far lateral herniation. Everything okay? So, she okay? All right, perfect. So we're right up against the back here. I'm going to advance this dilator through the disc herniation and into the disc. I need something here. Shot. So, shot. I felt it going. Stop. That's enough. Come off. I felt it going beautifully through the tear. All right, so that looks perfect. Let's go AP again and just verify everything looks good on the AP. Could be a little bit more medial, which I'm going to redirect to right now. I'm going to take the guide wire out. Take this, Luis. Take this. Give me the mallet. Shot. All right. I'm sorry? No, I don't want to put more dye. Nope. Nope. All right, that's where we are. All right, so we're right along the pedicle. You can see down below is 12. I'm sorry, 12 has the first rib, then 11, then 10, then 9. So we're at the 9-10 disc space. That's where we need to be. And we're inside the disc just laterally. That's where we want to be. There's absolutely no pressure on the spinal cord. And we're going to go in with our tubular. Go ahead and go lateral. We're going to go in with our tubular dilator. Once we get that in position, we'll be ready to start the laser part of the surgery. Shot. All right. So, she doing all right? Shot. So, beautiful. And again, we're lateral to the spinal cord. We don't want to be touching the spinal cord, and we're not. We're just to the side of it. Okay. I think that's as far as I can go. Shot. Yeah. To me, that looks good. Let's try to get the ribs lined up a little bit better. So, yeah, one or the other. Shot. No, that didn't work. Try the other way a little bit. I think that's a little bit better. Not perfect. Shot. All right, we're definitely in the herniation now. And our patient is comfortably asleep. We're going to remove the dilator and take a look at this, folks. This is it right here. Middle of the spine, this black line. We're going into the disc through a transforaminal approach at an angle, and it's definitely not the same as the lumbar. And you can see, based on that picture, we're inside the disc, in the lateral part of the disc, which is where we want to be. So we're going to go in endoscopically and remove what I can of the herniation, and hopefully that's enough to help her become asymptomatic. Fluoro out. All right. We know we're at T910 because we verified based on the pedicles. You get the laser? Yeah. All right, good. Okay, so, yeah. Laser on at 20, right?
Yes, sir.
Going to advance the fiber. We're going to go in, put on my irrigation, and there's the inside of the disc. I need to improve that. It's a little blurry, and there we go. Perfect. So, the blue is degenerated disc. That's the herniation. And let me get the laser fiber a little more forward. Here we go, and let's get started. So why is this surgery so revolutionary? Well, the only way to fix a symptomatic thoracic disc herniation would be with major spine surgery in the past. And that major spine surgery would be a thoracic laminectomy, likely with a fusion being necessary, because fusion to stabilize the segment after the laminectomy was done. Unfortunately, when you do a laminectomy on the thoracic spine and remove possibly part of the rib head, you can end up destabilizing the spine. And we don't want to do that, right? So being able to do this surgery endoscopically means that patients can have treatment without having to have fusion, which is always better. All right, I'm 12 o'clock. We have our laser fiber. We're inside the disc, and that's the herniation. I've shoved it back in the disc by pushing the dilator in and by pushing the tube in, okay? And what you're seeing here is an inside view of the thoracic disc at T910. So there's not a lot of disc material here, and look at the end plate. There's an end plate there, and there's an end plate there. So the disc is just very thin, and it's located right between the two end plates. Is it this hand that's dripping? Can you wrap that around there? Now remember, we can't be as cavalier here as we can be in the lumbar spine and get real aggressive trying to go medial, because your spinal cord is there, and we cannot have a spinal cord injury under any circumstances. That's the last thing in the world we want. This blue stuff is all herniated disc. And I'm basically using the laser to break it all up. A little bit of blood, no big deal. This is that disc herniation, right in there. Spinal cord is at 12 o'clock. We don't want to see it, but it's protected by the retractor. There's a little bit of herniation laterally there, so we'll go and get that. I don't want to get too carried away. We don't want to gild the lily. See if I can pull back a little more. what else we can see. There's, again, we're looking between the end plates right there. And I pulled back. It's probably, what is that noise?
That's probably something.
Remember, the herniations are not big in the thoracic. That's the epidural space. And I think we've gotten it. Let me see. Don't really see any more. Just about done.
Yeah, but so illustrate, please. You can, yes, please. Thank you.
Pretty cool just looking. Sometimes I can zap a little vein like that and get it to stop bleeding. Just about done. You okay? Just about done. A little bit of fat. Not worried about that. We're not here to get rid of fat. I think we're done. All right, light off, scope off, dilator. Just lay still. We're just wrapping everything up. Okay. So, feel good about that? You okay? Just lay still. We're almost done. Okay. Any chest pain or shortness of breath? What'd she say?
Any chest pain? What do you feel? Pressure?
Yeah, I'm putting pressure on you right now. That's me. How about now? Good?
You okay?
Okay.
Pressure still?
I'm putting pressure back on. That's my hand. Okay, let's take a look, folks, what we've got. Sean?
Yes, we can see.
All right, so I'm going to move the cables over, and you can see the whole surgery was done through that little 4mm cut, literally smaller than a pimple. All right, let's get that closed up.
Yes, sir. Thank you. Thank you.
Oh yeah, it's fine. Oh no, I would put that we did get we got the radicular pain. So I would just put radicular only. All right, if you have questions, type them up. So this is a right T910. I'm going to call her EBL 1 mil. No complications.